It was in 1796 that an English physician, Dr. Edward Jenner, introduced the smallpox vaccine. Vaccines have been formulated to prevent, to control, and eventually to eliminate infectious diseases as well as fatal diseases. However, in the recent past, there has been great resistance and hesitancy towards vaccines. And in 2019, the World Health Organization actually made a statement that this is a threat to public. We have today with us Dr. Pradnya Diggikar to dispel some of our doubts, to throw light on vaccines. Dr. Pradnya Diggikar, an MBBS and MD in medicine. She has also a certification in immunization, a certification in looking after people suffering from dementia. She is a postgraduate in rheumatology, a postgraduate also in geriatrics. Geriatrics is very, very close to her heart. She has spent years working on vaccines as well as on dementia. However, as stated earlier, geriatrics is very close to her heart, and we're going to throw some light on that also. Dr. Pradnya Diggikar.
Hello, ma'am.
It's so good to have you here.
Thank you, ma'am.
And we are here at the D.Y. Patil Hospital, a very grand hospital here in Pune city. My first question to you is, what are the reasons for this great hesitancy and resistance towards vaccines?
First of all, madam, vaccines are life-saving. The scientists are working day and night to prevent the infectious diseases, danger diseases which can cause morbidity and mortality in all over the world. So vaccines are the priority. It will prevent the hospitalization also, and the burden over the society and burden over the nation also. And it is the burden over the health workers also. Few factors like media, WhatsApp group, then newspaper, on TV, somebody is coming and telling this will happen, you will have the reactions, you will have lymph nodes in your axilla, then it is from animals like pig and cow. There is a fear in the society about the vaccines. And what happens? The real person who is the scientist, he is not coming forward to tell. So I have done the work, and this is the vaccine, these are the indications, and these are the few side effects. So this person is not coming in front of the people. So because of that, they are having hesitancy. And what I suggest that person, health minister who is educated or he is knowing the knowledge of the vaccine or the disease, he should come forward, and the person who is the leader of the country, he should take the first injection, first shot. Biden has taken, Putin has taken with his daughter. So the people feel confidence, they get faith in the leader and the vaccine. So these are the very important things people should know, and they will get the confidence about that vaccine, and they will come forward for the vaccination.
So you're saying the primary reason is confidence, where they don't have faith is the safety and efficacy of the vaccine.
Yes, madam.
All right. And social media, just as much as it is empowering, you're also saying that it is problematic.
Yes, madam.
Do you think that we should have, or do we have a portal here in India, online to educate people?
It is sad to say, but it is not available on the media. But at college level, medical college level, primary health center level, they are teaching. We are teaching to the students, interns, students, undergraduate student, postgraduate teacher, and we are having conferences also, national, state level.
Okay.
At that level, we are promoting these lectures, so that person will come and tell about the indications, importance, and some side effects of it. And there are very few side effects. And if suppose anaphylaxis occurs, you are in the hospital, we are telling the patient to sit for half an hour, come with breakfast. So within half an hour, he is under our observation. So if anything can happen, we are there to take care of him. So there should be no fear, no hesitancy for the, I will insist again and again,
Okay.
come forward for the vaccination.
So then we should have, I think, a dedicated portal to, diffuse all of this. I think all the doctors should get together and ask for something online, because today everybody goes online to find out information.
Yes, yes.
I guess documentation, etc., should be done, right?
Yes, yes.
Okay. What is the outcome eventually when you have so much of hesitancy?
So patient is coming to you at that level. If he is a diabetic, hypertensive, or heart disease, you have to tell, you treat his illness, but you inform him additional information that you have to go for the pneumococcal vaccination because you are immunocompromised. Go for the influenza vaccination and give some time to the patient so that he will understand it, and write on the paper that you are supposed to come next visit for this immunization. So this practice will build a level of confidence in the patient, and the treating physician is telling me to get vaccinated. That will be a bonding between the patient and the physician.
Oh, wonderful.
It should be very strong.
So you're saying that the recommendations should be very strong from the
Yes,
physician.
from the physician side.
Okay.
Yes, yes.
So it's got to be authoritative, very transparent.
Yes.
Yeah, the recommendations.
Yes.
Any other way of recommending? Are you saying that the doctors have to be more empathetic, more vigilant?
They should spare some time because they are so busy, but they have to spare some time for the patient, for the vaccination.
Okay.
So you can prevent the pandemics like this, no? Because patient will, if he is coming regular to you, just talk to him about the vaccination.
Yes,
That is my humble
that
advice.
yeah. That can build the bond and the
Yes, of course, it will. Yes,
yeah. But what about updating yourself? I mean, the doctors themselves, would they have to update themselves?
Yes, madam. It is the doctors who are the practitioners, BAMS or homeopathic, whatever they are doing practice, they are helping, no doubt. But they should get updated. They should join with us on attending conferences, and their license should be renewed. Yes, right. It should be renewed unless they attend the conferences.
Okay.
It should be compulsory so that they will get the knowledge while attending the conferences and listening to the renowned physicians and scientists. That will be helpful for them.
And this is, I think, a very good suggestion that they keep themselves updated regularly.
Yes.
This is about the hesitancy towards vaccines. We know that vaccines have been formulated to cure diseases, to fight the harmful cells in our bodies, especially cancer vaccines. And you have been working for a very long time on cancer vaccines.
I'm not working on the cancer.
Not on the cancer.
Yes, I'm working on the adult vaccination, madam.
That's the geriatric.
Yes, geriatric. Yeah, because cancer is the last point.
Yeah.
First is the infection. If you want to control the infection, so many diseases, I will enumerate the vaccines, like influenza vaccine, pneumococcal vaccine, hepatitis B vaccine, hepatitis C vaccine, then herpes zoster vaccine, hip vaccine, polio, dengue, so many vaccines are there. But this will lead to the mortality and morbidity. So for this, if we immunize them, it is available everywhere, and we can immunize them regularly at proper age, and proper duration should be there. So we can cover up this, we can prevent this disease load over the health workers.
So these vaccines that you just enumerated, are they limited only to ages over 60 and 65, or you're talking about these vaccines for different age groups?
Yes. So we know pediatric immunization card. So you have gone through the BCG, polio, tetanus, diphtheria, pertussis, measles, MMR, and so on. So we know about the pediatric card, but we don't have any adult immunization card. So even adult from 18 years onward, and 50 years, 60 years, and 65 years. These are my targets. So why my 18 years to 25 or 30 years? Because they are going other countries for education or traveling. So these are those countries like Europe or America or Southeast Asia countries. They need immunization. So Indian student will not be allowed to that country to enter in that country. They need MMR vaccine, influenza vaccine, and hepatitis A and B vaccine. The student should go under this vaccination. Then again he will enter in that country. The another group is 50. So here you suffer from diabetes, hypertension, kidney disease, sometimes malignancy, leukemia, lymphoma, kidney diseases. So in this age group, you are immunocompromised. These patients are immunocompromised. So the diabetic physician, he will treat your diabetes, hypertension, even nephrologist will treat. But he will not advise you go for the pneumococcal vaccination or influenza vaccination. So this should be done. So that group is immunocompromised with diseases. And the third group is my 60 plus, that is my area, geriatric group. So here, why they burden over the society? Because these people, because of the decreased immunity, they are prone to infection. So because they are having multiple illnesses, diabetes, hypertension, coronary heart disease, kidney disease. So they are having multiple diseases and they are elderly. So whenever they go, they are prone to develop pneumonia, or they will get admitted in the ICU, and the morbidity and mortality will be increased. Even influenza infection will also lead to the admission in the ICU. So this, if we immunize them, there is a schedule. It is in the book. There is a schedule. It is, and we don't follow it. But when the patients are coming to our geriatric OPD, we usually treat their whatever present problem is there, and we counsel them. You go for the pneumococcal vaccination, go for the influenza vaccination annually, take tetanus toxoid if you have not taken for 10 years. And if you are below the 60 years, then pneumococcal 13 conjugated vaccine is there, the conjugated vaccine. After 8 weeks, you can go for the 23 PPV polysaccharide vaccine for that. So he will be protected. And 65 plus people, they are again very prone for infection, as already I have said. So they are having the schedule. And we from DY Patil, we prepared a card because it is given in the book. The scientists have taken the National Health Ministry have the program for senior citizens, and even in other countries also they are having schedule program for the city. We have collected information from there, and we have prepared a card so that it will be easy for the senior citizen. Understand the name of the vaccine, the doses of the vaccine, and when to take, and what should be the interval between my first vaccine and the second different vaccine.
Yeah, we're going to highlight that card definitely. But there's also another list over here of other vaccines for the elderly people.
Yes, ma'am.
Are they similar to the ones that you spoke of? You have vaccination. This is the immunocompromised one.
Yes, we have already talked.
Excluding the HIV.
Yes, ma'am.
All right. Then you also have vaccination in HIV individuals.
Yes.
So you have a separate one for that.
Yes.
Also wonderful. You have vaccination in patients with diabetes. Okay, so those are the ones that you've been highlighting. So these are the lists. These are the names of the vaccines, the list that we're reading out. And of course, we will definitely highlight the picture in our podcast also so that you get a better idea of what we're talking about. You have vaccination in patients with chronic lung conditions.
Yes, madam. Zina and Gold. So this is the group of scientists we are having, and they have advised to take influenza vaccine compulsory every year, and pneumococcal vaccine, as I have said, in the interval of, even if he is young, but he is a case of bronchial asthma. So he can take this vaccine. They have to take this vaccine, influenza and pneumococcal vaccine compulsory. They should.
Okay, and how long does that vaccine last for then?
So if pneumococcal, then it will be for lifelong.
Yeah.
But,
and
for influenza, you have to take annually, every year, because different variants are coming. But you have to take it every year. Or influenza vaccine.
Okay, I'm going to come back to that again. There's another one, vaccination in patients with chronic kidney disease.
Yes, madam. So nephrology, our National Society of Nephrology, they have advised vaccination, same influenza, pneumococcal, but they are on dialysis. So hepatitis A, B and C, hepatitis B vaccine, 3 doses they should go for that, and hepatitis C also 3 doses for that.
So you have an A, B and a C.
There
Hepatitis A, B
A, B, C. Yes, we are.
Okay.
But
Okay.
yes, but B and C are transmitted by the blood transfusion or sexually transmitted diseases.
So when you say sexually transmitted disease, although we're digressing a little bit right now, uh, can you transmit your HPV or hepatitis A and B through oral sex also?
Yes, madam. Hepatitis B and C
Hmm.
are transmitted. Human papilloma virus, it is in younger groups. So we are having vaccine, HPV vaccine. 3 doses are there for boys and girls before the puberty, and they have to complete it within 20 years of their life.
Yeah.
So
So
cervical cancer will be prevented by taking 3 doses in younger females.
All right. And you talked of all the travel vaccines that they have to take.
Yes.
Very, very important.
Yes, madam. So
Yeah.
we Indians are very good in traveling. So everywhere, whenever you go there, you will find Indians. So, but people visiting India,
Yeah.
people are visiting India, they should get vaccinated because of so many sanitation problem and infections are more in our India. So malaria, they have to take prophylaxis for malaria.
Okay.
They should get through with the dengue vaccine, typhoid vaccine. If you are visiting America, so they will include MMR vaccine, more common. So it should be then Tdap, tetanus, pertussis, so diphtheria, tetanus, diphtheria, and pertussis. So you have to take this. You should take this vaccine while going there. And in sub-Saharan countries and Africa, you have to take yellow fever vaccine. It is again mosquito borne and a single dose for lifelong.
Yeah.
Yes.
So since geriatrics is so very close to your heart, one more question that I need to ask you is all these vaccines are available, right? And when they come to you, you enlighten them. You tell them that this is available. But what about the larger population? I mean, do you have some kind of drives? How would the others know? Because some of them who are, closeted in their homes and already ailing maybe, how would you reach out to them?
So in our college, my students, undergraduate student, residents, in COVID period, we have prepared the posters by their hand, and we labeled the vaccine how it looks, and we have written their doses and side effect and name of the vaccine and where it should, the interval between the vaccine.
Okay.
So we made the poster in our OPD. Anybody can read and ask. So this awareness we made from our side, but this should be at primary health center. This should be available on the each practitioner. He should put up the name of the vaccines in his clinic.
All right.
So that people will repeatedly think that this is the vaccine, these are available and I should go for that. So this should be there. And in conferences, we discuss everything. Even online also, some physicians, they have given the information regarding these vaccines also.
Okay, brilliant. I understand. I mean, sometimes these vaccines can be very expensive, even the other ones that we're going to talk about in a bit. You've also worked on reducing the price.
Yes, ma'am.
Could you tell us that? But this is how it's happening, yes.
How it happened, actually, when I saw the cost is 1,600 and 1,800. So how can my poor patient will make it? I talked to one of our medical representative. He was telling me, these are the vaccine, please madam, write it, keep it in your pen. Then I said, is it available? Can you reduce it? The cost. So then he said, I will talk to my manager here.
Okay.
And then they called me, madam, you just arrange our camp and we'll make it available. So we got at 50% less he provided.
That's a huge discount.
Yes, madam.
Yeah.
So all my resident doctors, interns, and my maushi mamas, sisters, I provided them for in my first. But he is cooperative with us, and anytime whenever we call him, he's providing us in 50%. Even pneumococcal vaccine also. With pneumococcal vaccine, it is more than 4,000, but he made it 2,100 only. And it is...
That is more than half.
Yes, madam.
More than
Yes.
half.
Yes. So
From 4,000 to 2,100.
Yes, madam. He is doing that case for our OPD.
So nice. That's real.
Since 4 years, we have on the occasion of our Honorable PD Sir birthday on 17th February, 4 years back, 2018. We have started this OPD, and we are completing 4 years of it this year.
Nice. This is wonderful contribution to society. So much needed, actually. Vaccines. You've spoken about so many of them right now. Tell us about these, various types of vaccines, the 5 different vaccines that we have, cancer vaccines, because cancer is on the increase nowadays.
Yes, madam. Now we were talking about the infections. Now scientists they are working on the cancer vaccine, and now they are stating that cancer is a treatable disease. So it is a very good news for us. Cancer vaccines are divided into preventive. So we can prevent, for example, in immunopapillovirus, Cervirax or Gardasil 9. These are the on different variants of that virus. So this, and even hepatitis B vaccine. So you can, if you give 3 doses of this vaccine, it prevents cervical cancers. Hepatitis B, if you give 3 doses, you can prevent hepatoma. So cancer of the liver you can prevent. And the others are therapeutic vaccines. For example, the BCG vaccine. So what BCG vaccine, we are using it for the prevention of the tuberculosis. So everybody in India, we had our BCG vaccination, but they have studied in cancer of the bladder. So cancer of the bladder, they use this vaccine as a bladder wash. So inside through the catheter, they are putting this vaccine, and in early stages, they are stating that it has reduced the incidence or complications of the CA bladder has reduced. And second is the Sipulacil T, which is the vaccine composed of patient's own stimulated dendritic cells.
HPV is so rampant today. Yes, and I read that there are very many strains
Yes,
of
madam.
HPV. Quite few. So that one vaccine will help eliminate all these strains, or there is a variety for each strain? Which is it?
Madam, Gardasil 9 is there. So it works on that 16, 18, 31, 33, 45, 52 and 58. These are the strains which are more prone to develop cervical cancer. So this may be related to the head and neck malignancy, penile malignancy, throat, vulvar, vaginal cancers. So these are the strains which are covered by the Gardasil 9. Gardasil 9 vaccine.
And there's another one, the Gardasil.
Yes, that is plain Gardasil. It is again against the 16, 18, 6 and 11 strain. So it will cover that only.
So we have 2 different types actually of HPV. Yes. And how do you understand you have HPV?
Number 1 is pap smear, and second is the cone biopsy. So if the pap smear is having this type of strains in that pap smear, this report is there. If then you will ask the patient for the colposcopy and cervical cone biopsy will be taken. And if it is normal, then you go for the vaccination for that particular patient.
Okay, wow. There's so much to health.
Yes, madam. Yes, it is.
And these kinds of vaccines, again, especially for cancer also, how do we educate people about it? Because education is important. Doctors will, when you go to them and you're ailing. So do we have to have some kind of strong system, an online system of asking you again?
Madam, there are so many doctors are coming on the media, or they are telling about the importance of CA breast, you palpate your breast, or in prostate cancer, even liver cancer. So they are telling the symptoms. So my lecture is there, early detection of cancer. It is a different lecture, and in that lecture I have mentioned so many cancers. Means suppose CA breast. So you palpate, you teach the female patient that you have to palpate your breast with your hand, and anything which, if it is palpable, lump, small lump, you go to the surgeon or physician for that. So they will investigate you. Uh, Even in suppose prostate cancer patients, what happened? They are having urinary complaints. They will have some symptoms are there, but PSA is the uh, test which will be positive. The normal they are doing it, but we have to follow it. Follow up should be there. Follow up of the patient should be there. Even if it is normal, we have diagnosed the case of CA prostate because we are having interventional radiologist, Dr. Vikas sir is there. So he took out the biopsy because the lymph node was there. But the prostate was normal, PSA was normal, and we have published this case also. So even in lung cancer, patient is complaining of cough. He is complaining of loss of appetite. Cough is there, dry cough is there, and you are not getting sputum. So you can't see the malignant cells. So bronchoscopy should be done. So in bronchoscopy, they take out the ball or they take out the sputum or some biopsy and you can diagnose. But in another case, it was we had a 100% thought that he is having malignancy, but we are not having any evidence. So they took the biopsy from the esophagus, they gone to the mediastinum, took out the lymph node biopsy and it came out positive. So it is not grade 1, grade 0 condition you can diagnose the malignancy. And that patient took 12 cycles and he is still alive.
Of radiology,
Yes.
science. Okay. Wow.
Chemotherapy.
The more I talk with it, the more my mind keeps wandering. There are so many people out there who really need to be educated in all of this.
Yes, madam, even gynec malignancy, there are CA19, CA121 markers are there. So these are the tumor markers.
Okay.
Various tumor markers. Suppose in hepatoma, alpha fetoprotein, this is raised. So if it is coming in thousands, we suspect this is hepatoma. Okay, like that. So here there are markers CA19, CA121. So these are gynecological malignancies are diagnosed accordingly.
And you normally get this kind of malignancy from your tumor,
Yes.
from your fibroids, etc.
Yes.
Doctor, I can go on and I'm sure you can also go on. And we're going to have another podcast, I'm very sure, because I need for people to understand some more about health.
Yes.
And my dear ones out there, the only thing I can say is please go in for screenings, please go in for health checkups as often as possible. If you find the slightest bit of indication that you're feeling unwell and that persists, because it's the persistent of any disease that can actually indicate that there could be something wrong. Maybe not necessarily a cancer or anything very dangerous, but it would be better to go to a doctor and to check up. Yes? This is my bit of advice. Doctor, would you like to say something to our audience over there?
I will just say that whenever you are going to the doctor, you listen to what investigation. Whenever we advise you the lab test, you said so many things are you are writing, but it is important because whenever your BSL sugar is raised, so it will affect your kidney also. So we have to do the kidney function test. Your cholesterol, so cholesterol is important because you have to start the treatment for the cholesterol. ECG is important because if you are suffering from heart disease, you don't have symptoms, but there may be the evidence of on ECG cardiac disease. We ask you to go for the eye checkup. Why? Because if there is a retinopathy, you may suddenly lose your vision. So one side or retinopathies or papilledema. So that is why we send you for the eye checkup. A diabetic patient, we are sending him for eye checkup. Now we will ask you for the ultrasonography. Why? Because we want to know the size of your kidney. Sometimes one kidney is shrunken, so all the load is on the normal kidney. So we will not prescribe you the nephrotoxic drugs which are not safe for your kidney. So this is the way we for urine checkup also we are asking. So albumin is there, ketone is there. So we have to rule out that also. So even sonography, we ask for the gynec sonography. So many times ovarian tumor is there, uterine tumor is there. Sometimes prostates are enlarged. So that is why we are asking you to get through this. And normally you make your mind that every year you have to go for this health checkup. When you are going for the shopping, I always tell my female patient, you are buying 5,000 sari and you are not going for the investigation for 1 or 2, 3,000. You are not spending on this. So that is very important. You go at least investigate your normal routine checkup with normal, keep it with you. And after 6 months, 1 year, only few things we will go for. The even thyroid, we miss the thyroid disease. People, I'm loss of hair is there, I'm putting weight, I'm dull mood, I couldn't sleep. So this may be the hypothyroidism. So for hypothyroidism only, we will not ask for the T3, T4, TSH. We'll ask for the free T3, free T4 also, and sonography of the thyroid also, ECG because it affects heart also, cholesterol, it affects cholesterol also. So these are all interrelated. So don't say that doctor are telling you a big list. So it is for you, it is for your health.
Well, doctor, thank you so much for actually speaking on this over here, because the fear of getting to know that okay, you're suffering from a disease actually stops certain people. But then it is necessary for you to pluck up that courage and go and check so that you live longer and you live a healthier life. Thank you all so much. God bless all of you. Thank you, doctor.
Thank you very much, madam. Thank you.
God bless you.